Basal joint arthritis. Introduction.
Which of the following is the basal joint?
Choose one of the following options.
Correct. This is the basal joint, the joint that connects the metacarpal bone of the thumb to the wrist bone. The aim of the operation is to remove the tendon of the thumb.
Select true or false.
Correct. The aim of the operation is to replace the basal joint of the thumb with an artificial joint or a piece of tendon. Are infections very common after hand surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections, bleeding, and scarring may occur.
Paralysis, infection, and bleeding are common after hand surgery.
Select true or false.
Correct. Paralysis, infection, and bleeding are very rare in hand surgery. Although these risks are rare, they can still happen. This operation is very successful in improving the symptoms.
Select true or false.
Correct. Even though the operation is successful most of the time, sometimes it may not help the symptoms. The arthritis may recur.
Thank you for using Explain.